The knee is a complex joint with many components, making it very vulnerable to a variety of injuries. That complexity is why knee injuries are the most common reason to visit an orthopedic surgeon. Dr. Charles Stewart of Boca Raton Regional Hospital joins us this noon to tell us much more. Thanks for joining us, first of all, Doctor.
Good morning. Let's
talk about the most common knee injury here. It appears to be a torn meniscus. Correct me if I'm wrong.
Torn menisci are the most common reason people come to see us for knee injuries. The meniscus is the little shock absorber that's inside the knee. There's one on each side. People typically call it a torn cartilage. What's interesting, it doesn't have to be truly an injury. Half the people I operate on say they never hurt themselves because the meniscus has no blood supply. It has no nerves, so when you hurt it, you often don't know it until 2 or 3 days later. It manifests itself by pain and swelling, inability to do activities. But there's a wide variety of presentations. Some people come into me in a wheelchair, they can't walk. Other people just played 3 sets of tennis and say, my knee aches afterwards. Wow. It's the most common one we see. It's diagnosed by clinical exam, by history, and endpoint by an MRI, or magnetic resonance imaging.
Sure. You know, there's another one out there, the patella femoral syndrome.
The most common reason I see people for, from 10 years of age to 90, is patellofemoral syndrome. And so when people come into my office and they complain of pain in the front of their knee, it hurts to go up and down steps, hurts to squat down, hurts to kneel down, that's patellofemoral. That is pain underneath the kneecap. It's not necessarily an arthritic condition because it occurs in 10-year-olds. I'm presently taking care of a 19-year-old who's terribly incapacitated by it. So it can be very common to happen. It sometimes happens after an injury. You're in a car wreck, your knee hits the dashboard. It often happens after you've been doing something excessive. You're painting the baseboards of your home and you're kneeling down for 4 hours.
Sure.
That can bring it on. Also very common for people, they move into a 3-story house. They had not used to stairs. That will bring it on.
You deal with it. What can you do with treatment, you know, once you have these conditions?
For meniscal tears, many people have them and live with it. We don't rush off to operate on people right away. The only ultimate cure is knee arthroscopy, the microsurgery we do to take out the torn piece. But most people, especially if they're not active, learn to live with it. Some people take medications, over-the-counter drugs like Advil and Aleve. Some people have shots of steroid, but ultimately, if you're active, you'll need arthroscopic surgery.
And the recovery time? You know, people want to get back out there.
Recovery time is usually you're back to work in 3 days.
Wow.
You're back in the gym on the 5th day, riding a bike. You're back on the tennis court in 3 weeks.
Very nice. That's knowledge from Dr. Stewart here. Thank you so much for joining us.
Thank you.
Boca Raton Regional Hospital sponsors our expert in underwrites, our Ask the Doctor feature.